Hi everyone, today I am going to continue CPC question and answer CPC exam pattern. So I am going to discuss some of the questions. So I am reading out the first question. In which part of the body would you find the choroid? The options are brain, eyeball, muscles of the hand, spinal column. So the question is, in which part of the human body the choroid is present? So here in the image you can see the choroid layer which is present in the eyeball region. This is the structure of the eyeball. So the choroid is present in the eyeball layer of the human body. So the answer for the first question is eyeball. So I am marking this one. So option B is the correct answer. So we will see second question. The second question is, which combining form refers to the small intestine? So the medical term for small intestine is entero, gastro, coelo, colo. So the correct answer for small intestine combining form is entero. So the answer for the second question is entero. The another term for small intestine is entero. So we will see third question. An ERG is what type of a procedure? ERG is a procedure. What does it will do, and what is ERG? The options are electroretinography, electrorenalography, electroretinograph, electrohydrogram. So the question is, what is the procedure of ERG? See here in the image you can see what the specialist is doing. He is examining the eye retina. So ERG is nothing but electroretinography. So this is a study who will read out about the retina of the eye. So electroretinography is a procedure which is nothing but ERG. So the correct answer for third one is option A. So I am marking this one. We will see remaining questions. Which medical term refers to anus and rectum? In the medical coding we have some combination codes. So the combination codes for anus and rectum. What is the combination code for this? We will see some of the options here. Rectal, anorectal, esophagus, ileum. So clearly we can see anorectal. It's nothing but anus and rectum. So this is the medical term for anus and rectum. So the option for the fourth question is anorectal. So we will see the remaining question. Which term does not refer to a level of consciousness? So the question is, here are some of the options. There are some related words related to level of consciousness, but there is one option which is nowhere related to level of consciousness. So I am reading out the options. Syncope, stupor, coma, sciatica. So syncope, all these are nothing but, suppose if a patient had some fall suddenly, so we'll call those kind of words in the medical terminology like syncope, stupor, coma. But sciatica, it is nowhere related to level of consciousness. Sciatica is a radiating leg pain. So the question here is, which is not related to level of consciousness? The word which is nowhere related to level of consciousness is nothing but sciatica. So the correct answer for fifth question is sciatica. So I am marking this one. So these are some of the question and answers of the CPC. I am going to discuss remaining question and answers in the next session. If you have any queries, please comment below.